Welcome everybody to the ARC Michigan 2021 Disability Policy Webinar Series. We're glad you are here for the first week. So a few details before we get started. If you look in the upper right-hand corner of your screen, you should see an orange arrow, and this is your GoToWebinar control panel. If you've joined us today via the app on your phone, the control panel is either at the top or bottom of your screen in a pull-down menu. If you have any issues with your audio, you're going to want to go into that GoToWebinar control panel, click on the audio tab, and do the mic and speaker sound check. Participants are muted for this presentation, but your questions and comments can be typed into the chat area. A link to the handouts is available if you look in your GoToWebinar control panel and click on the handouts tab. You'll be able to find it there. It's also available on the ARC Michigan website, www.arcmi.org. And if you were to lose your screen at any point, look for the blue flower icon in your taskbar to bring it back up. So today we have with us Sherry Boyd, Director of the ARC Michigan.
Good morning, everyone. I want to thank you for joining us for our first of a series of 4 Friday morning governmental affairs, public policy, information sessions. I have the pleasure of introducing this morning the ARC Michigan lobbyist, Christin Nohner. She's the Senior Government Affairs Consultant at RWC Advocacy. She joined them in January of 2020, and she's serving as the Director of State and Federal Government Relations. Before that, she worked at the Michigan State Medical Society, and before that, she worked at the Michigan Academy of Family Physicians. In her early career, she was also a staffer on the Capitol Hill for the House of Reps and the Senate. So she has a range of experience in policy issues from health care to energy and the environment. She has a bachelor's degree from the University of Notre Dame and a master's of public policy degree from George Mason University. Thank you, Christin, for joining us this morning. It's a pleasure.
Thanks, Sherry. And thanks to the great team at the ARC for the opportunity to speak today and kind of review all of the happenings around Lansing. As you can imagine, it's pretty busy downtown, and we've got a lot of emerging budget and policy issues that we're going to talk about today, especially coming out of the pandemic. There's issues that have kind of been simmering for a number of years that have kind of now bubbled to the surface and are all kind of being debated at once, it seems like. So there's a lot of waterfront to cover here today. But I kind of want to start with a review of the policymaking landscape, talk a little bit about the executive and legislative branch composition for this year, and kind of go from there. So a lot of the work that we do in our advocacy with the ARC is centered on the executive branch as well as the legislative branch. And specifically within the executive branch, we, depending on the circumstances, will engage with the governor's office or the executive office, and then the key leaders at the departments, specifically the Michigan Department of Health and Human Services. And within that, most often we engage with Behavioral Health and Developmental Disabilities Administration and the Medical Services Administration, which oversees the Medicaid program. And every so often, we'll also engage with the Michigan Department of Education if there are issues that arise around special education and any education issues that kind of cross over into our work. But those are kind of the agencies I would say we interface with the most on the ARC's key policy priorities. So as I mentioned, the Michigan Department of Health and Human Services is probably the agency we engage with the most. And within that, it's helpful to know who the players are and who to go to depending on the circumstances surrounding your issue. Elizabeth Hertel is the director of the Michigan Department of Health and Human Services. She assumed that role earlier this year after the departure of Director Robert Gordon. She's pretty known person around Lansing. She worked in the legislature for a number of years. She was working for a hospital system for a while and back with the department. So she's a pretty well-known person around Lansing. David Kniezek is the Chief Deputy for Administration. He was a former senator, went into the AG's office for a short stint, and now is supporting Elizabeth with MDHHS work. Dr. Janae Caldoon, pretty prominent person currently, in the special circumstances we find her in with the pandemic. She's been probably one of the most, I would say, public-facing chief medical executives that Michigan has seen because of the need to hold press conferences around the pandemic and lead that response. Alan Jansen, the Deputy Director for BUDA is what we call it, BHDDA. Al is someone that we interface with a lot in our work. I would say probably most often within the MDHHS, the issues that we work on cross over into the Behavioral Health and Developmental Disabilities Administration. So Al is a key person that we work with. Kate Massey, the Senior Deputy Director for Medicaid, oversees the Medicaid program. And then I also wanted to mention Emily Schwarzkopf. She's a key person to know because she is that sort of go-between the legislature and the department on any issues that the department wants to get done legislatively. She's kind of deployed to work across those sort of agency chamber lines. Now, kind of focusing on the legislative branch, we do have two chambers, the Michigan House of Representatives and the Michigan Senate, 148 total members. We have a year-round kind of full-time legislature, and it is funny because I work with a lot of groups around the country, and I have been getting emails recently about I know a lot of your sessions are wrapping up soon, and I just kind of laugh to myself because I'm like, our session never wraps up, really. It's a lot like Congress in that we sine die usually at the in this case the end of December 2022. Kick right back up again in January. We'll kick right back up again in January 2023. So we do have a 2-year session, but things really don't stop for much of a long period of time. We get that break, kind of in the summer briefly and around the holidays, but I really make a lot of comparisons with Congress in terms of how the Michigan legislative branch operates. And I think I've shown this this illustration before, but I think it just is a helpful visual of where Michigan stands compared to other legislatures around the country. Michigan is, you can see that dark green, what the NCSL would consider kind of full-time, well-paid, although maybe some would say that's arguable, but and large staff, again, some would say that's arguable, but in comparison to other states, we do stand out in that regard. A lot of states, the majority of states are in that hybrid category, which I believe the NCSL defines as not paying well enough that the legislators can maintain this as their primary role. In those hybrid states, they have to take on other work, other professions, along with their lawmaking profession. And they also generally don't have a big staff, if any staff, and they're not, the staff is not as active as in Michigan. One of the other unique things about Michigan that's really important to touch on is term limits, which went into effect beginning 1993. And our term limits are among the strictest in the nation. And obviously there are some benefits and pitfalls to that. I've really heard mixed reviews. I think in the years since they've been implemented. I've been in Michigan for 10 years, and I came from the congressional setting where people can stay there till they're 95. I think of Robert Byrd, who was in a wheelchair. I think he's a senator from West Virginia. I think one of the oldest, longest serving senators. And you would see him just being, wheeled around his office in the halls of Congress, and he was still at it, which is, in some people's eyes, great. Other people would say, we really do need some fresh perspectives in there, and people to kind of turn over and infuse just a different energy. So, there was some obviously criticisms of Congress and people staying there too long. But on the flip side, with the legislative term limits we have in Michigan, you'll see that there's so much turnover, you really have a drain of that institutional knowledge. And I see that as a huge pitfall with the term limits in terms of that term limits argument. And so, that's something that's kind of constantly debated, constantly mulled over. I don't see that changing anytime soon necessarily, but I know that people, put proposals out there, put their kind of stake in the ground in terms of whether that should change, and it continues to kind of get mixed reviews in terms of whether it serves the people of Michigan. So I'm going to run through the current political landscape for this 2021-2022 legislative session. We have 28 new freshman representatives. We saw the House mostly stay the same in terms of Republican majority. The Republicans lost two seats, but gained 2 seats. And so that majority really stayed the same as it was last session. I know there was a lot of hope around Democratic circles that there would be much bigger gains for the Democrats in the House in Michigan, and we just did not see that bear out. So while there were some pickups, there were some unexpected losses. As is customary with every new legislative session, we have new House leadership. Representative Jason Wentworth is the new Speaker of the House, with Representative Donna Lazinski as the Democrat leader. And we also in the House have a couple of new committees. Previously, we had a process whereby almost all of the bills that went through a first committee. So for example, the Health Policy Committee would have to go through a second committee process through the Ways and Means Committee. And that was implemented in the last session, and that's no longer the case, that bills always have to go through a second committee. On a case-by-case basis, there will be a 2-committee process, depending on kind of the call of the speaker and other kind of factors. But now the Health Policy Committee, for example, can report a bill directly to the floor, which has generally been the process up until last session. I did also want to mention the Senate vacancies. We did not have elections for the Michigan Senate in 2020, so generally didn't see any major changes there in terms of leadership. A few changes in terms of committee chair positions and that sort of thing. But there were 2 senators that vacated their seats for a different elected office, Senator Pete McGregor, who chaired the MDHHS Appropriations Subcommittee Budget, and someone who was pretty well known and well regarded in kind of health appropriation circles. So that was an unfortunate loss for, I think, the Senate Republican caucus. He went to be the Kent County Treasurer. And then Pete Lucido took the role as the Macomb County Prosecutor and left and vacated his seat. So there's a special election for those 2 seats coming up here in November. I believe the primary is in August with the general in November. So the Republicans are operating on a little bit of a slimmer majority, but nonetheless still have a majority in the Senate, with Senate Majority Leader Mike Shirkey leading the chamber, and Senate Minority Leader Jim Ananich on the Democratic side. And I already mentioned the Republican majorities in the House. I did also want to point out that in terms of the Republican power dynamic in the state legislature, it's been pretty strong since 2010, when the Republicans took over the House. They've had the majority in both chambers. And in fact, in the Senate, they've had the majority since 1984. So I know that that's a lot of the impetus, or a lot of the, I think, justification that people point to for this new redistricting process, that the lines were not drawn in a favorable way, or in an equitable way, I guess I should say, to ensure that the state legislature is represented in a way that reflects the broader Michigan population and political dynamics. So the Republicans have really held those strong majorities at the state legislative level for quite some time. And I mentioned the redistricting process, which is unfolding at this time. There's been a lot of scrutiny around when the maps are going to be drawn, because census data was delayed, and there's still, I think, some unknowns about when we'll see new maps, but the process is still unfolding in terms of taking in public comment around the state, and determining where input, and making sure they're collecting input from a myriad of stakeholders around the state. So in terms of the state budget, there's been a lot of just kind of, I would say, activity and scrutiny, and just a lot of focus on the budget this year, because there were so many unknowns with the pandemic. And there was a year ago, during the May Consensus Revenue Estimating Conference in 2020, there was such a bleak picture that was painted of where we were going to go with the budget in the state, and the big hole that we were going to have to dig out of. That hole did not come to bear, and I'm going to talk a little bit more about the most recent May Consensus Revenue Estimating Conference. But the budget process in Michigan has really been filled with, positives and negatives, and all differing kind of perspectives in terms of where we stand from a fiscal standpoint. So on the current fiscal year side of things, we're in the fiscal year 2021 cycle. So we operate on a October 1 to September 30th fiscal year cycle. So we're currently in the FY21 budget, and we have this process called supplemental appropriations, which augment or adjust, I guess I should say, the budget that was put into place at the beginning of the fiscal year. Sometimes those supplementals are in the positive, if, for example, our revenues come in higher than expected, or if we have an influx or an infusion of federal dollars like we're seeing. We can also see negative supplementals, so negative adjustments if our economic or fiscal picture isn't what expectations were at the outset of the fiscal year. So for this year, we've mostly seen very positive numbers come in, exceeding expectations in almost every regard. And a lot of that is just the federal stimulus money that's come into the state. We've had several stimulus packages throughout 2020. The two most recent ones were the December stimulus, which hasn't all been spent in Michigan, but I believe is all purposed. And then we have the American Rescue Plan Act, which I'm going to get to in more detail here in a second. In the midst of this discussion around FY21 and what to do with all this federal money, we also have the current budget process for the next fiscal year, which will begin October 1, so the FY22 budget. So there's a lot of different things going on right now in terms of where the state is at and figuring out what our priorities are. So with the American Rescue Plan Act, I wanted to just kind of outline what I've been hearing in terms of state leadership priorities, whether that be the Senate leaders, Republican leaders, or Democratic leaders, the House, or the governor. And there's really a lot that's been thrown out in terms of how we should purpose these dollars. It's important to keep in mind that these are one-time funds, so they're going to, be spent, and then if there's not kind of a sustainable funding stream that can support a program with state dollars going forward, then that could create a potential exposure in our state budget. So a lot of the conversation is around how do we purpose these one-time dollars in a way that gives us those sustainable gains in the long run. So you'll hear the Republicans talk a lot about infrastructure, specifically dams. I've heard a lot about debt servicing and ensuring that we don't have any structural budget issues going forward. A lot of this federal money can offset state dollars and free up state dollars for other purposes. So I think there's a lot of scrutiny around ensuring that this is spent in a way that helps Michigan in the long run. The governor just released a proposal that's pretty extensive. It was just yesterday, so I have not reviewed in depth, but it does talk about small business relief and unemployment supports, as well as bringing up that bringing that minimum wage up to $15 an hour, and supporting childcare for working families. So these are just some of the issues, or I guess I should say the priorities that the state leaders have thrown out. And in terms of the numbers, I know there's all kinds of numbers thrown out around how much the state has received. I think the biggest number is upwards of $20 billion, and it's important to keep in mind that that kind of breaks down into some of it isn't full discretionary with the state coffers, within the state coffers. Some of it's purpose for elementary emergency relief for schools, some of it's purpose for unemployment, and some of it's local restricted funds. So the $6+ billion that I mentioned here is really the money that's going directly to the state relief fund that the legislature is currently looking at. The other important piece that I think the ARC and the audiences that follow the ARC would be interested in is the federal match increase. So there was a general FMAP increase that was tied to the federal state of emergency. It was a 6.2% increase, which I believe has been extended through the end of this year at least by the Biden administration, and potentially beyond that. And then there's also within the American Rescue Plan, there's a 10% proposed home and community-based services increase baked in there too. So, and I believe that would, previously I was under the understanding that was going to just run through April of next year, and now I think CMS has provided some clarification that could potentially be used through 2024. So I know that the fiscal folks are looking at where that might make sense, and ensuring that again, if those federal dollars are used to create new programs or new services, that those don't go away when that federal money dries up, and that's something that the state is going to be able to sustain over time. It's a big conversation. In terms of the ARC's priorities, the ARC has shared their priorities with legislative leaders in the state budget office and what they would like to see prioritized with the American Rescue Plan Act dollars. And I mentioned just a handful here. But these are kind of the main items that we've been focusing on in our advocacy. You know, certainly that My Choice expansion and ensuring there's you know, home and community-based services that are looked at beyond just what's currently available. So we're looking at housing, looking at transportation. The direct care workers is a huge issue that we've been working on, and ensuring there's kind of a permanent solution so that direct care workers are fairly compensated. And now, you know, with the emerging debate around the $15 minimum wage, that changes the conversation again, because you kind of run into these competition issues for these workers. And so if you're not able to, you know, with Medicaid dollars, give them a fair wage, we're just not going to attract the workers that we need to serve our population. And CCBHC, for those who aren't familiar with the acronym, it's Certified Community Behavioral Health Center. And this is a federally sanctioned program that Senator Debbie Stabenow actually spearheaded. And Michigan has been one of the big CCBHC expansion states. And what CCBHC sites aim to do is to integrate at the site a kind of the source of that clinical care, behavioral health services, and physical services, all in one place. So it's really that effort to achieve integration that's being piloted in several sites around the state. In terms of the FY22 budget, I just wanted to outline some of the issues that have been put into either the governor's recommended budget or the Senate or the House budget. And so these aren't necessarily all in, you know, all three budgets, but they've at least all been suggested by one party or another, or potentially two. The My Choice waiver slots seems to be universally supported by the administration and the legislature, and I would assume that that increase in slots is going to be in any final agreement on the budget. Direct care workers, again, you know, generally embraced across the aisle, across the administration and legislative branches, and I feel cautiously optimistic that wage increase that we've been working hard for is going to get into a final agreement. CCBHC, another widely embraced on both sides of both chambers, both branches and sides of the aisle. Autism Navigators is going to move from a one-time program to an ongoing program. So it's going to have kind of a sustainable funding stream for that. KB versus Lyon, this is a fairly large appropriation that the governor's budget included that's tied to the settlement related to this case and potential kind of policy response to address children's behavioral health needs. And then the remaining items are, again, you know, generally embraced on both sides. It's just kind of getting down to that specific dollar amount and what that looks like. Medicaid funding, you know, we're going to see, you know, higher numbers in terms of total Medicaid funding, again, because of that FMAP increase. And I believe in what if I understand correctly, what the Consensus Revenue Estimating Conference disclosed was that our anticipated caseload for Medicaid was actually much lower than what was projected. So they're not expecting the same sort of pressures on the Medicaid budget that were previously forecasted. So the FY22 budget right now is in conference negotiations. So the governor has released her budget, House and Senate released theirs. They've deliberated in their respective chambers, and now the legislature is in conference negotiations, which purportedly should include the state budget office and the governor's office. And I think that, you know, I think that's going on to a certain extent, and hopefully all sides can come to an agreement by July 1st, which is that deadline to get a budget to the governor's June will see a lot of activity in terms of conference operations and trying to get that budget done. You know, I think it's one of those roller coaster things where one day I hear positive things, the next day I hear things, you know, aren't going as smoothly. So you just kind of have to ride it out till the end and hope that everyone can have a little bit of July to take a break from budget talk. As I mentioned, the May Consensus Revenue Estimating Conference was, I would say, compared to May 2020, so much more optimistic and hopeful than I think anyone could have anticipated. And so much of that was just all of the federal stimulus dollars that have come into the state. Not only those direct supports, you know, you have unemployment and you have, you know, the direct money that came into our appropriations coffers for various programs, but you also had, you know, stimulus checks and people spending more than was anticipated. So consumer spending really exceeded expectations. And so in addition to having this influx of federal dollars, we have revenues exceeding expectations to the tune of $3.5 billion in higher revenues for this fiscal year and the next fiscal year that we were not expecting. So a pretty big budget surplus. And it's important to make the distinction that, again, that federal stimulus money that's coming in is just one-time money, but the revenue, those revenue dollars that we weren't anticipating, you know, that's much more fungible and can kind of be baked into an operating budget for a longer term sustainability. But I kind of include this quote from Mary Ann Cleary with the Director of House Fiscal Agency because you know, really the discussion was, you know, we have so much money, which some would say is maybe even more of a problem when you have so much money. But we're really in a position that no one in their wildest imagination could have imagined we'd be in. And that's not to say that there aren't major economic concerns because of kind of a two-track recovery with the services and hospitality industry really suffering, and you know, certain industries still really suffering. But the state budget picture is so much more positive than we could have imagined. So I mentioned the budget process here, and it's really you know, a matter of the House and Senate coming together on their respective budget proposals in conference, hopefully in collaboration with the governor. We do have that July 1 statutory deadline for the House and Senate to get a budget to the governor's desk. If you follow this closely, you may recall that last year, that budget deadline, which is new, it actually has not been abided by yet because it went into effect pre-COVID. But because of the pandemic and because of the uncertainty and the forecasting that came out of the May Revenue Estimating Conference last year, there was no, the budget deadline was waived by the legislature. So they continued their deliberations until the end of September. And I think that that's still possible, that the House and Senate can send a budget to the governor's desk, and there will be still some areas of negotiation. I think the hope is that those broader themes, those broader numbers and targets can be hit and agreed upon between the two branches of government. So current legislative issues, obviously in the background we have the COVID-19 recovery that continues to go on and really impact so much of the dialogue downtown. You know, we have discussions around vaccines, we have discussions around, you know, ensuring that that people can see their loved ones in hospital settings. You know, the nursing home issue continues to be an area of scrutiny. So we're going to kind of continue to see some of these issues that have been a little politicized, to just be, I guess, diplomatic about it. They've been a little politicized, but as we get closer to an election, I think we'll continue to see a lot of these COVID-19 issues continue to be debated and spotlighted downtown. But I want to mention, and I kind of referenced this in the beginning of my talk, that I have seen, and this is generally the case in the beginning of a session when you're farthest away from an election, but I've seen bigger issues emerge and debated in this session, I feel like, than in any session I've worked in since coming to Michigan. And I think that, so much of that is that the pandemic has really shown a light on, some of the specifically healthcare issues that, we've always acknowledged that there's fragmentation and some need for reforms, but it's really brought all of that to the surface. So, I wanted to mention kind of those two big issues that the ARC is following, behavioral health integration and reform. And then there's a package of healthcare bills that passed out of the House that address transparency in pharmaceuticals, PBM reform, pharmacy benefit manager reform, access to care, just generally. So we're following a lot of those issues that are percolating now over in the Senate. And then the House and Senate are looking at separate behavioral health integration reform proposals as well. And then the two other big issues, at least in my mind, that I feel like are at the forefront of discussions in Lansing right now is police reform. After the year anniversary of the George Floyd tragedy, the Senate actually released a bipartisan police reform package that had progressive Democrats on it to Republican sponsors. And that just started debate just this week. And it's going to draw a lot of attention, I know. And I think that the House, at the very least, is going to see some Democratic action on police reform. Election reform, again, a pretty political and contentious issue that's drawn in all players from the business community to just your everyday constituent. And I think that, the general lines have been drawn that Republicans are responding to their constituents who don't feel like the election was fairly administered, and that, possibly Joe Biden didn't win fairly, and that we really need to look at our processes and how we conduct elections, which unfortunately has led in some people's minds to a discussion around making voting a little bit more challenging. And so I know that there's typically, conservative players like business community leaders who have come out and said that this isn't an area where we really want to be disenfranchising people. And I think that there's going to continue to be a lot of scrutiny around the elections and looking at reforms, which I can't imagine that at least what's moving through the legislature right now would get signed into law by the governor. But nonetheless, they're going to debate that issue in response to those constituent concerns that I'm sure people continue to hear. So these are just some of the resources that I would recommend if you want to really dig into not only kind of the structural aspects of how the legislative branch operates and how the executive branch operates, but then the fiscal agencies do a really good job of digging more into the policy issues and getting into details. And so if you have a particular issue that you're interested in, they usually have great resources there. And I went a little bit under time here at 40 minutes, but I figure that we can leave some time for questions, and then I don't have to take up too much of your time this morning. So with that, I will hand things back over to the ARC team.
Thank you, Christin. If anybody has any questions, you can type them now in the GoToWebinar control panel. We do have 2 questions right now. So when you're talking about the fiscal year 22 budget having extra revenue, Where is that coming from?
That's a lot of it's coming just from increased tax dollars, that sales tax, for example, that was not previously anticipated in some of the economic forecasts. So economists, in the state have 2 opportunities a year to come together with these revenue estimating conferences in January and May. And they make these predictions around, okay, we're going to set our budget targets based on what we think is going to come into the state through, taxes, for example, or, federal dollars. And they adjust targets based on that. Now, what happened was that a lot of the federal stimulus that helped prop up incomes, there was the work share program, there was obviously direct stimulus checks to people, that boosted spending more than was anticipated. And so, and Michigan, I should also say, in some of my research, we've done a lot better comparatively when you look at other states, because the auto industry has been stronger than was previously predicted. So auto sales have really been held up. I know there's still some challenges with getting certain parts, and that continues to be a challenge there, but just generally auto sales have come in stronger, and that's helped kind of prop the state up and bring in more revenues for the state. And so that leads to kind of our budget surpluses that we're looking at going into the next fiscal year and with this current fiscal year. Hopefully that answers the question.
Thank you. If not, I will watch for a follow-up in the chat box. All right, next question. When you're talking about the upcoming redistricting, when is that happening, and how do regular people that aren't on the commission participate?
I know that the public comment period is unfolding right now. I believe you should be able to find more information on the Secretary of State's website, or if you just Google Michigan Independent Redistricting Commission, they should pull up the meetings that they're having around the state. And I know that they're trying to collect that public feedback right now. In terms of the process, and I don't know what the latest and greatest is, if anything's changed just in the last few days. But as I understand it, maps were due in November of this year. And because that census data that was anticipated has been delayed, there's been a request to extend the deadline to submit those maps, I believe, until January of next year. So we might not have new maps drawn until early 2022.
Thank you. Next question is about the direct care worker support. Where can we find information about where that currently stands, and a possible higher rate of pay?
So currently we have in place a wage increase for direct care workers, $2 an hour, and I know it's dependent on setting, so it's not across the board in the behavioral health space, but generally the My Choice program, and then on the aging side, there's direct care workers getting that $2 an hour. That is in place until the end of the fiscal year, which is September 30th. And the discussion now is what does that look like, for the long term, for the next budget, and are we going to be looking at another temporary extension, or is this going to be a permanent wage increase of $2 an hour or $2.25 an hour, as has been proposed by the Senate? So the good news is, in terms of status on that, that we have a great champion in the Senate with the Senate Appropriations Committee Chair, Jim Stamas. And he is deeply embedded in those budget conversations going on right now, as is, the governor's office is a big champion. The House has been a little bit quieter on the direct care worker wage increase and ensuring it's in that next fiscal year budget. They put a placeholder in their proposed budget, but all signals that I see point to the House, negotiating with the Senate and the Senate getting, and the governor's office getting what they are aiming for with that $2 an hour wage increase going into effect, hopefully permanently, beginning October 1, 2021.
Thank you. I also shared a link in the chat for the ARC Michigan resources related to the direct care crisis.
Yeah, I was actually going to say that's a great resource to point people to if you want to learn more about that.
Next question. I think this question goes back to what you were saying about the budget surplus. So for several years, consumers of CMH services have been told that about budget cuts, and therefore their services have to be cut. Do you anticipate that the surplus would mean a restoration of services?
I think that that's hard to say, drilling that far down at this point. I think the aim is certainly to ensure that there's behavioral health supports are, shored up. I know that that's something that you hear the Republicans and the Democrats talk about. So to the extent that there's services that haven't been funded, that we'll need to have that that looked at. I think that I guess I don't have a tangible example in my mind of this particular service, but I do think that just as a general theme that behavioral health supports are going to continue to be really I think debated and embraced in terms of getting those dollars down to people on both sides of the aisle. I hear at least the rhetoric is going in that direction. I can't say drilling down that far that a final agreement will address this service yet, but I think that with the increase in revenues, with all these federal dollars, that generally we should see a more robust services at that level. I should also mention that this debate about behavioral health integration and where that goes, that could change the whole structure of who manages the funds. Representative Mary Whiteford has put forward a proposal that would make an administrative services organization, so one statewide entity that contracts with the department would administer funds and look at the needs of the state. There's other policy proposals around giving that kind of jurisdiction to the Medicaid health plans, which I know is not supported by the ARC. So, in addition to all of this funding that's coming in and these revenue increases, we also could just see some structural changes in the coming years around, and that could revamp how these services are reviewed and paid for.
A follow-up question to that. Will general fund dollars be allocated to take care of those with high spend down amounts?
I don't know that has been a conversation. I have not been close to that conversation, and I would probably lean on Sherry a little bit more to talk about that, or whether that would be something that a federal federal dollars that are coming into the state through the increased FMAP would support or augment. I don't
So this
believe
is
there's
Sherry.
any conversation around GF doing that, Sherry.
Yeah, general fund dollars are just always the problem. There's not enough of them in the state of Michigan, and the ARC continually advocates, for the general fund dollars that were cut, 4 or 5 years ago to be put back into the CMH system, and, it hasn't happened, but we'll continue to work on that issue. We know it's a problem. There was some hope with the resubmission of waivers that the increase in income would go up so that more people would get out of the spend down problem. And so when that happens, that will help some folks. But we're just hurry up and wait on when that happens. But we are always aware of the issue around general fund.
Thank you for that answer, ladies. I do have one last question. Can you define the word integration with regards to behavioral health reform? Isn't this the integration of behavioral health and physical health? It's often misunderstood that we're talking about social integration.
Sherry, do you want to take that question?
Can you repeat the question? I didn't hear it fully.
All right, so we're trying to understand the definition of the word integration when we're talking about behavioral health reform.
Okay.
Are you talking about behavioral health with physical health? Because some people misunderstand it that we're talking about social integration.
Well, in our world these days, because there's a big push for behavioral integration, there has been talk that the Senate is going to put out a proposal that will integrate at the financial level, at the admin level, the physical health and behavioral health. That hasn't gone anywhere yet formally, but that would mean that the money would go, the behavioral health money would go to Medicaid health plans in the state of Michigan, and they would administrate the dollars. Representative Whiteford put forth 5 bills this week that look at integrating or behavioral health reform. I don't even know how much she uses integration, but revamping the system to include one entity that is in charge of all the CMHs, which would mean that they would eliminate the PIHP system. And right now, that's the prepaid inpatient health plans, and there's 10 of those in Michigan. And so they would create another entity. It's not necessarily something they would call as a prepaid inpatient health plan, but it would be called something like an administrative service organization that would get the dollars and dispense them to local CMHs and maybe some other providers. It's just going to depend on what gets negotiated. But that's the most advanced behavioral health care integration or reform that's going on right now. So I hope that answers the question. But when we talk, as the ARC, when we talk about integration, we're talking about integration at the person level, because we don't believe that putting the money together at the top is going to make anything better. We worried about the health plans. They have a higher administrative rate in terms of dollars coming off the top. They have a board of directors that, can make money. So we have a lot of concerns about tax dollars going to profits to private health plans. So, I could go on and on, but I'll stop now.
Yeah, no, Sherry, that was great. And I would just speak, for the policymakers, I think from their perspective, when they talk about integration, they're talking about integrating behavioral health services with physical health services. But to your point, Sherry, I don't think that the House is necessarily looking at a wholesale integration effort, but the Senate, particularly Senate Majority Leader Mike Shirkey, would really like to see that those physical health services in Medicaid that are provided by the health plans integrated with the behavioral health side. And so that is when we talk about integration or hear about it downtown, that's generally where that's coming from.
Can you explain what an administrative service organizations are and what they would do if implemented?
Well, not at the risk of getting too technical, they would function like as a PIHP does, you know, in that they would get the money, they would, you know, make sure that it's getting spent correctly by the locals that get the money. I mean, it would be it's one system instead of 10 different regional systems monitoring things, essentially. I mean, that's not the technical answer. I mean, you can get into how much insurance you have to have and all those things that really, are way beyond my area of understanding. But it would be an organization that is essentially replacing the 10 PIHPs, and they would work closely with the contract enforcement of the state.
And if you are familiar at all with what's going on in any other state in terms of their delivery of behavioral health services, my understanding from Representative Whiteford, and she elaborated a little bit more on this during the hearing on these bills yesterday, her bill that would create this administrative services organization is modeled off of several other states like Connecticut and Maryland and Washington and I believe New Mexico. There were about 6 or 7 states that have a similar ASO entity, and that's what she's modeling her proposal off of.
Thank you for that information. So it is 10:57, and I will end with this very last question. How and when can people make their voices heard in the state budget process?
Really, the best time would be during the subcommittee deliberations. Those usually start in March. So we have the full appropriations committees on both sides, House and Senate. And then we have subcommittees that have jurisdiction over, for example, the MDHHS budget. And those subcommittees hold public hearings from various stakeholders, and you can provide input at that point. The ARC also, through my group, my firm, and the partners that we work with the ARC, we are part of, we follow those budget conversations all the way through the process. So even beyond those subcommittee deliberations, we're staying pretty close to those chairs and those committee members, and ensuring that those key priorities, for example, the direct care worker wage increase, those key priorities stay at the forefront of those conversations throughout the whole process. We kind of act as that voice, but I would say that would never, exclude anyone who would want to be part of those conversations necessarily, and that for the purposes of public comment, that those subcommittees really act as those platforms.
And the public comment periods are posted on the House and Senate's websites in March so that you would know when to do it if you're looking to do public testimony. Obviously, we've done a lot on Zoom lately, but the other thing that's really effective is written testimony. I mean, you can send emails to the appropriate, you can do lots of different things. It doesn't necessarily have to be in person per se.
And if there is ever a budget question or issue that arises, and Sherry, I don't want to speak for you, but I know this to be true, that the ARC is always receptive to hearing that feedback, and then looking at the advocacy, what advocacy could go on around that accordingly.
Absolutely.
Thank you, ladies. I personally enjoy the ARC Michigan newsletters that I receive that keep me up to date on what's happening across the state.
And
That
I think Courtney probably can share the link to sign up in the chat so people can sign up to get that information, because that would have updates about public testimony in it, pretty timely.
Right, that brings us to 11 o'clock and the end of our webinar today. Sherry?
I want to thank everyone for joining us today. I hope you learned something new. I know that I did listening to Christin. I also want to remind everybody that it's the governmental affairs appeal time for us. So if you feel compelled, I know Courtney will put the link into the chat box so people can make a donation so that we are able to keep working on the many public policy issues that we try to stay abreast of. Anyway, I hope everyone is well. Have a great day and enjoy your weekend. Thank you.
Thank you so much.